What I can definitely tell you, Beth, is that the best thing we can do to protect ourselves, protect our country, and ensure that we have as normal a Christmas as possible is to get boosted now. And it's just amazing to be here in this vaccination centre in London, in Westminster, and see huge numbers of people listening to that message, coming forward, and the way the NHS is responding is just inspiring. The GPs, the volunteers, all the nurses and doctors really pulling out all the stops, and we will ramp it up over the next few days because it is a huge target that we've set ourselves, but the risk is plainly there. We can see Omicron spiking now in London and some other parts of the country. Here in the capital, it probably represents about 40% of the cases. By tomorrow, it'll be the majority of the cases, and it's increasing the whole time. And sadly, yes, Omicron is producing hospitalizations, and sadly, at least one patient has now been confirmed to have died with Omicron. So I think the idea that this is somehow a milder version of the virus, I think that's something we need to set on one side and just recognise the sheer pace at which it accelerates through the population. So the best thing we can all do is get our boosters. We're opening up centres across the country. We're getting in the army to help with the logistics. We're expanding in every possible way. And what we need now is for the public to respond and to do what is necessary. Get boosted now.
Prime Minister, the question I asked though was, can you rule out more restrictions? And it seems you can't because you didn't. So you can't rule out more restrictions before Christmas.
Let me just say on that throughout the pandemic, Beth, I've been at great pains to stress to the public that we have to watch where the pandemic is going, and we take whatever steps are necessary to protect public health.
You have new data coming on Saturday.
We think that the steps that we're taking, so Plan B, combined with a hugely ambitious acceleration of the booster campaign, bringing it forward by a month, so we offer a booster to every adult by the end of the year. We think that's the right approach, and I think the most important thing everybody can do is get boosted now.
Just finally on that, on Saturday you are going to get new data. It'll be December the 18th. You can't tell me now whether you might have to introduce further restrictions.
What I can tell you is that we think that looking at the balance of the risks, looking at the epidemiology, looking at where we are with Omicron, looking at everything we know, don't forget there are still some important things we don't know about Omicron. We think that this is the best approach. Combination of Plan B, which is some sensible steps to slow the spread of the virus, to buy us some time, to help to reduce the infections and, of course, the mortality rate, and then combine that with rapidly building up our booster defences. And everybody should remember that the reason we're doing this is because it became clear on Friday that 2 jabs were not enough. Do you remember? So that was the key moment when we realised we had to accelerate the booster campaign, because 3 jabs does 2 jabs plus a booster does lift your level of protection right back up.
Do you regret not doing more earlier in the autumn now on the booster programme? Because that's been some of the criticism, that this is all too little, too late. Also, the vaccine website's crashed this morning and you can't get any home tests. Yeah. Lateral flow tests have run out. So
several things there, Beth. Number one, I think the people of this country and the NHS, the GPs, the staff, the volunteers, they should be incredibly proud of the vaccine rollout. This is the fastest booster rollout anywhere in Europe. I think it's almost double the percentage of most other European countries we've done in the UK. We're going incredibly fast. Yes, we now want to hit warp speed, and we'll have to attain a pace and a number of daily booster doses that will exceed anything that we've done before. But I've got no doubt at all that we have the people, we have the enthusiasm, we have the fundamental optimism about what we can do, which we've learned from the experience of the last 18 months, and I know that people are going to rise to this.
You're asking people to isolate or take daily tests from tomorrow if they come into contact with someone from COVID, but they can't get any. I mean,
they can. Thank you, Beth. They can get those tests. We do have a ready supply of tests.
The site says there aren't any left. You can't order them.
We do have a ready supply of lateral flow tests. If you can't get one online for any reason, then there are ample supplies in the shops. But what I think, if I may say so, what that also shows is that people are doing the sensible thing and getting tests as well.
Just in terms of, I have two more things to ask you that I think are very important. In terms of the restrictions, which you say are very important that people adhere to the new rules that you are voting on tomorrow, up to 75% of your own, 75 of your own MPs say they won't support it.
Yeah.
So that means you can't even keep basic public health messaging and votes under your control, and you're the Prime Minister. You've got to rely on Labour. That is a desperate state of affairs. It's not sustainable, is it?
I think that what everybody needs to recognise is a couple of things, that Omicron is a very serious risk to public health, and that it's spreading very fast. And I think there's no room for complacency. But we have the vaccines. Our position remains incomparably better than it was last year. And I hope that people will also understand, colleagues in Westminster, around the country, will also see that the measures we're putting in place are balanced and proportionate, and it is because of the vaccine rollout, because of what we've done, that we actually have an economy and a society that is more open than virtually any other in Europe. And what we will also do now is greatly intensify, accelerate that vaccine, that booster rollout, and urge everybody to get boosted.
That you need Labour votes to get this critical measures passed. I mean, that's terrible.
Beth, I will make my case to my friends, to the public, to everybody. What drives me in this is concern for public health. And what I think is absolutely obvious to everybody who studies the data is that if we can get boosted now, protect ourselves now, then we'll have a much, much better chance of having a protected NHS going into next year. We won't have the NHS overwhelmed. People won't have cancellations of cancer appointments and other vital clinical needs so much next year because we've got boosted now. And the other crucial point is, of course, that we'll be protecting our society, protecting our livelihoods, and allowing ourselves to keep going forward in the way that we have over the last few months.
I've got a final question on Christmas parties.
Yes.
Numerous parties have now been recorded or reported about in Number 10 during the lockdown last year. And now it emerges that you hosted a Christmas party quiz with groups of people in various rooms in Number 10 when such things were banned. Have you asked Simon Case to investigate you?
I can tell you once again that I certainly broke no rules. All that is being looked into. But if I may respectfully say to you, Beth, I do think that when you look at, and of course all that must be properly gone into, and you'll be hearing from the Cabinet Secretary about it all. But frankly, when I look at what we're trying to do now, the crucial thing is that people understand the challenge that is posed by Omicron, but also understand that this is a challenge that collectively we can meet. We have the resources, we have the vaccines, we have the vaccinators. We're recruiting more. We're getting more people to volunteer. We'll be opening up more services and mobilising, and I hope snowballing a big national campaign. And that is, frankly, what I think I'm focused on.
It appears that the public care that you seem to have participated in a social event in Number 10 when everyone was told not to.
And I hear you, Beth.
But you would have seen all your staff members on Zooms in groups around the building. So you're saying it didn't happen?
I can tell you that I certainly broke no rules, but the whole thing will be looked into by the Cabinet Secretary. And what I'm focused on, frankly, is the vaccine rollout and the campaign for get everybody to understand how vital it is to get boosted now.
So you've asked Simon Case to look at the December 15 event, just to be clear.
He's looking at all these things.
December the 15 event.
If that's is that the thing with the Zoom call?
Yes.
Yeah.
Okay.
But frankly, I think what everybody and you know, we'll report back on all that. Though, as I say, I
By the end of this week,
I certainly break no rules. As soon as we reasonably can. But the key thing is that we have a national campaign, a national mission, and we need to get it done. We need everybody to understand the vital importance of getting boosted now. I think people are, and it's pretty humbling to see the numbers of people coming forward. It's pretty amazing to see the spirit with which the vaccinators are responding.